Good morning. Welcome to Salina Regional's Morning Medical. The earlier breast cancer is found, the easier it is to treat, and mammograms are the best diagnosis. With me I have imaging techs from Salina Regional Health Center, Chris Hooper, and from COMCARE, Cami Lichtenwalter. Thank you so much for being on the show. I understand there's a newer technology, which is the Genius 3D mammography, which we have at Salina Regional Health Center and at COMCARE. Tell us what the difference is between 2D and 3D mammographies.
Well, 2D and 3D is actually pretty similar. We're still taking the same 4 projections of the breast. It's just in 3D mammography, we're taking multiple images millimeter apart, and then they reconstruct those images, and it provides more information of your breast for the radiologist. As you can see in the image, on the left-hand side is a 2D image of a breast. The same breast is imaged on the right-hand side using the 3D mammography. In the multiple images, in image 43, you can see the cancer that's underlying in all that breast tissue. We're able to see it a lot better in the 3D as opposed to just the 2D, where it's obscured in the breast tissue.
So visually, if this deck of cards represents your breast, your breast is 3-dimensional. Your mammogram should be as well. So basically, we have all this tissue that we need to get through. So as we take the multiple images, image number 15 itself may not be very clear, but if we go through to image 40, it is. So we are able to see things much more clearly and with greater accuracy.
Okay, we've seen the difference between what the 2D and the 3D is. How about from the patient's perspective? What's the difference?
Well, from the patient's perspective in the room, there is virtually no difference because we do the same exact pictures. You are still in compression and they are acquired the exact same way. But what you will notice is that each exposure takes roughly 6 seconds longer and the tube head will move slightly while the exposure is being taken.
So we understand that when women come in for their first mammogram, it's very uncomfortable and they're very nervous about it, as well as even the women that come in for their annual mammogram are uncomfortable about it. There's a reason why we do the compression, and it's because it reduces how much radiation you're exposed to, and it also spreads out that tissue so that if there is an underlying lesion, we can see that better. But we do our best to talk you through that procedure and hope that when you come out of the procedure, you have a more positive attitude about a mammogram.
Thank you so much for being on the show, talking about this very important topic. Thank you for watching. For more information, please visit srhc.com, like us on Facebook, and follow us on Twitter.